Happy Tuesday, everyone. Carol Brockmiller from Quincy Medical Group. Wow, thank you for watching yesterday's video. That was amazing. Your questions, your feedback, your comments, really helpful. It just, it gives us some guidance on, are we on the right track? Does it resonate with folks? What's next? Where do we go from here, sort of thing. After all, it's you who we serve. And so feedback matters, and keep that coming, please. It is really helpful. I firmly believe, we firmly believe that healthcare is physician-centered, patient-focused, and basically at the beginning and end of every day, there's a physician and a patient in a room together, in a relationship together, working on the patient's optimal health. It is a rapport that is achieved over time. If you have that special physician, those individuals in the background on my poster, then you know of what I speak and why that is so important in healthcare, to have that relationship with somebody. Our physicians are owners of Quincy Medical Group. They make the investment in our growth. They take the risk on any new ventures, and they alone really bear the responsibility for the financial and clinical outcomes of every visit, every surgery, every decision that they make. It's a very heavy reminder of what it's like to be a physician, but I suspect it is also the thing that reminds them why they went to school in the first place, why they became a physician, why they want to practice medicine, and on the really long days, it is probably the thing that sustains them, is that connection with people and making a difference in somebody's lives. I think that's immeasurable, if I had to guess, and certainly the physicians say so. As a for-profit entity, we pay our own way, and there is no grant, no special funding, no municipality, no, we earn every penny, and it's because of our physicians and our providers. We have 115 physicians, there's 50 nurse practitioners and physician's assistants, and then there's hundreds of professionals who also provide direct patient care and who bill for those services. And then there's all of the caregivers and all of the non-clinical people who are in the background taking care of everything. But it is the physicians whose license and reputation, and in this case, business, is on the line when they make decisions like this. So that's a big deal. We serve all patients. We see commercial insurance, Medicare, Medicaid, everything. Always have and always will. I just don't sense that it's not anywhere we spend our time anyway, I can tell you about that. Because we are for profit, we are also very prudent with our resources. We understand balancing a budget and making choices based upon value and where you want to go and what that means to you and your family. We are an efficient group. I mentioned that yesterday, that, we are nimble and quick and responsive, and it doesn't take 6 people or 6 months or an act of Congress to get something done around here. So I will tell you that sometimes the CON process has been challenging for us. We're not used to going through some of the process, and we hope that it closes soon and turns out well. 2 weeks from today, we will return to Bolingbrook to the CON board and seek approval for our surgery center. And we hope that we receive that. It is time to move on with this. It's time to work on our surgery center and get that open. And so tomorrow we will spend some time talking about surgery center, timeline, location, reasons for what we did and why we did certain things. And hopefully that will be the next part of the puzzle. So send in your questions, your comments, your feedback, anything that you think we need to know to serve the community better. That would be super helpful. Anyway, have a great Tuesday, and I will talk to you tomorrow. Bye.